It takes one different number that will change the entire price of your procedure. The way with hospitals, most times, even though if they're nonprofit, they still have an incentive to make sure that they get the most out of you as a patient.
Healthcare is as inelastic as it gets if you want to live. Welcome to another episode of Money in the Bank with Frank. Today I've got Kayla Shawn with me. She's the founder, CEO of the Healthcare Navigator. Kayla, thank you so much for coming on.
Thank you for having me. I'm super excited to talk with you.
Yeah, I mean, as you know, healthcare, is a near and dear to my heart for multiple reasons, but ultimately from a financial services point of view, when you see something so glaringly obviously so glaringly wrong, or one might say that there's a tremendous amount of power in this industry, you either want to own it long or sell it short because of the change that's coming. And that
Right.
kind of timing, super difficult. But we do know one of two things. It's either going to get even better for the incumbents or real change is coming. What are your
Right.
thoughts?
I I have a two-pronged approach. I do think that in terms of consumerism, right? So on the side of patients being able to actually navigate the system easier. I do think that it's going to be easier just because of technology, right? Everyone
Mhm.
nowadays is used to Amazon one day delivery, same day delivery. They're about to come out with drones. So everything is, the market is, moving towards anything that is convenient and anything that is easy to access. And so patients naturally are going to want to go to hospitals that are easy to go to, want to go to, pharmacies that are in and out, things like that, that they can, do most of it on their phone. So in
Uh-huh.
that sense, the market itself is just going to go that way because that's consumer preference. And
Uh-huh.
healthcare, even though, it's one of those industries that it's not the same as everyone else. The rule still applies to healthcare in that sense. And so in the sense of making it easier and more convenient, that is the way I think it's going to go. But in terms of it being, I would say, because it's so complicated, right? It's not a straightforward industry. There's a lot of complicated, not only just terminology, but things within the industry. And so on the side of it being complicated, like insurance, like, you know, in terms of what can be covered, what's not, what's in network, what's out of network, that is still going to be difficult for patients to navigate because
Uh-huh.
it's just not straightforward in that sense. So, there are some hopeful things, but there are some things that are just going to get harder as we go on.
I appreciate that, and really, the thing that's really fascinating and amazing is that there are people like you stepping into the breaches that came from the big healthcare names and saw opportunities to make it better. And I looked at your webpage and got some information for you prior to this, and I'm just really excited about what you're doing. Can you kind of tell everybody? Because what you're doing, obviously, we want healthcare to get better, but you're here handling things now
Yeah.
and working on things right now that people can, you know,
Right.
maybe didn't even know have the option to do.
Yeah. Well, a lot of people don't know. Um, there's a lot of things in healthcare that the average patient doesn't know. And so, for those who don't know about the Healthcare Navigator, for employers, we are an employee steerage program. So that means that we steer your employees towards quality care that's also cost effective. So instead of employees, going towards the regular pitfalls of healthcare where, they go, let's say you have a hospital in your neighborhood that is like 5 miles away versus another one that's about 10 or 15. You don't know what the quality of care is for both of those hospitals based off of clinical performance metrics, like what the actual evidence is. You know the reviews, but you don't know actual hard evidence. Same thing with your doctor, right? Most people don't know what their doctor's MIPS score is. Most people don't even know what an MIPS score actually is, which is
Mhm,
just the, the overall performance score of that doctor that CMS gives everybody.
mhm,
Same thing for prices, right? Most people don't know what the price of a procedure is until they get the bill after the procedure. So there are a lot of these things that are normalized in healthcare that, take the patient or the employee to a place where now they're making very poor both financial decisions, but also they're not even making decisions based off of the best quality because they have no idea which ones are best and which ones aren't. And so that's where we come in to guide people and steer them to places that are, good quality, that do have prices that aren't ridiculous. And we do that by showing you everything, right? So a hospital, if you're looking for a brain MRI, you can go to our app and it will tell you all the hospitals that do the brain MRI, the prices for them, the performance metrics, all of that good stuff. And so same thing for so many aspects of healthcare is what we really dive into. And so that is in a nutshell what we do.
that's great. So I had, an experience where I was representing, an eyewear solution company that had,
Mhm.
as a one of the benefit fairs, and ended up sitting next to a former benefit broker who, uh, transitioned like you over to, one of these steering companies. And when I heard what they did, I was so fascinated because, this solves a small, problem that a big problem that
Right.
employers have. It's that, like, the benefits department has chosen all of these menus of benefits, right? And
Right.
then when something happens to one of the employees, they assume that they've got them covered, but they don't know how to navigate that process. And
Right.
some employers actually do have, like, this was for the city of Houston. They
Mhm.
had a navigator who could act as an advocate for the employee to help them through this traumatic problem that they're probably going through right now,
Right.
and then expected to learn the healthcare system
Right.
magically,
Yeah,
right?
in 60 seconds or less.
Yeah,
Yeah.
yeah. So that's, you know, at the very least, I feel like if one of the, CHROs or somebody in benefits wasn't doing this role at the company, it's almost a fiduciary duty, a breach of fiduciary
Right.
duty for them not to have someone
Yeah.
outsourced like you to be able to help their employees with those
Yes. Well,
issues.
yeah, I mean, from a business standpoint, right, healthcare is one of the riskiest parts of the business, which they don't teach you that when you get your MBA, but you slowly realize that because for most employers, healthcare costs are second behind wages, right?
Mhm,
And that's so to a regular person that seems so bizarre, but it's true, right? And
mhm,
so when it comes to just being able to manage the risk of healthcare, it's extremely hard if you do not have someone that's in the industry, right? That's like
mhm,
putting, someone who does, plumbing in like plopping them in healthcare and saying like, all right, like figure it out when they've had no experience and they've only had experience plumbing. And
mhm,
it's not one of those industries where you can get it right away. You cannot Google the price of a procedure. You cannot Google your doctor's MIPS score. You can't Google, um, if, for example, like how to negotiate your medical bill and then actually be able to do it. Like that's just not how it works. And so
mhm,
there's so many things where it's it almost falls on the part of like negligence if you don't, because there are so many issues that both your employees need to be guided through, but also for your company as well.
mhm. Yeah, I mean, comes front and center. I could list a number of things that are so basic that people do wrong just by going to the doctor the very first time, right? When they go to their doctor, you walk
Right.
in, the first thing that comes out of their mouth is, which pharmacy do you want us to deliver to? It's like,
Mhm.
I haven't even seen the doctor. There may be nothing wrong with me.
Yeah.
You
Yeah.
already want to know where I'm going to prescribe where I'm going to get the prescription without even
Right,
knowing what the drug is and figuring out, like, who's got the best price,
right.
using what limited tools there are out there, right?
Exactly.
And if you multiply that out for, "Hey, I just found out that I have some exotic disease that, or some problem that is not gonna resolve itself anytime shortly," and then you have to figure out, pulling out your insurance card, trying to figure out, "Well, who's gonna take care of me? Like, what am I supposed to do?"
Right. Yeah. Well, it's interesting. We actually had an issue last, I think it was about 2 weeks ago. It was during the Christmas time. And one of our users, she went to go get her breast cancer screening, and she went to an imaging center that it said it was in network, but they have multiple locations, and there's only one location that was in network. So all of
Mhm,
the other 7 locations in Texas were out of network, but no one told her, "You have to go to this one," and so she ended up getting a ridiculously high, I think it was like $3,000 when it should have just been free, because
uh-huh,
that's a
uh-huh,
preventative care screening that has to be, um, mandated by the Affordable Care Act, has to be free for patients. And
uh-huh.
so it's things like that where, like, unless you have, someone to help navigate that, even people who have, because she had the healthcare navigator, so she went to us after the fact, but it's things like that that are so mundane, and you think like, "Oh, I don't need navigating to find the imaging center. They told me where to go." Well, no, you do, because there are certain locations you can and cannot go to. So it's things
Yeah.
like that that are just honestly ridiculously, and stupidly, and to be quite frank, stupidly complex, that it shouldn't be that way, but that's just the way it is right now.
Oh, for sure, for sure. I mean, I feed off catching the tricks when they're done to me, right? So I have I'm at the age where I have to go get scoped, and
Mm.
so I, reached out to, my primary care physician and was relying on them to, make an introduction to a facility, which
Mhm.
obviously for 3 years hasn't been happening, and, like,
Right.
finally we got that. We've got it scheduled for this month, and I've called so many times just to make sure that they know, because I've got a high deductible plan.
Yeah.
This is built in. And of course they call, right? And they call and they're asking you questions because they wanna find out, is
Mm.
there a reason that we can change this from
Yeah.
one code, which is
Right.
diagnostic, right?
Right.
And I may be wrong on the terminology, but, like, they wanna bill me, right?
No,
I
yeah,
I have this coming to me, but they really wanna bill me, you know?
right. So what's so crazy is that they have the billing codes, like CPT codes and diagnostic codes and things like that. It takes one different number that will change the entire price of your procedure
Mhm.
by a landslide. And I remember we had a patient who she put in, because you're able to analyze your medical bill on our app. So she put
Okay.
in, and this is from her user testimonial. So she put in her medical bill, and it found on all of the CPT codes, they billed her as an infant. And obviously, if you're an infant, it's going to be way more expensive, because neonatal and things like that are just way more complex to the average adult. And so
Mhm.
that easily changed her bill by $5,000 just by one different, just like, 'cause I think there were 6 digits. So the last digit was, the culprit, but it's things like that where it literally just takes one different click, and it's a totally different price. And again, what average patient knows CPT codes?
Yeah, and just
Nobody.
imagine if there was, like, a unified claims processing solution that could see
Right,
that my birth date is, 1970 blah,
right,
and I'm not an infant,
right,
right? Like,
exactly. But
is that
it's
not kinda obvious, right?
But it's also, yeah, it's also
And the
like,
problem, it doesn't ever seem to fall in your favor.
yeah. Well, there's always, when it comes to healthcare and hospitals, and again, this isn't all hospitals. There are some that are
Mhm,
amazing and do really well with billing ethics, when we actually track those hospitals that do really, really well, right? But there are some who just do not have good ethics when it comes to billing, and
mhm,
they just have a pattern of doing the same thing over and over again. Some of them don't even wanna talk to you when you see that there's an error, and it's just ridiculous because they know that the way with hospitals most times, even though if they're nonprofit, they still have an incentive to make sure that they get the most out of you as a patient. And again, not all hospitals, but a way more than need
message
be,
find
right, are like that. And so they're more incentivized to try and extract as much out of you. Same thing with, like, them calling you, right? They wanna be able to upcharge as much as possible to hit their revenue marks, right? To
Mhm,
make sure to increase shareholder value, etcetera. And
mhm.
so it's at the end of the day, healthcare is a business now, right? It's not back in the, 1800s, 1900s where it was just a calling, it's not a calling anymore, it's a business, unfortunately, and so
I
you have to
wanna
navigate that.
I just wanna kind of drive into that a little bit to really explain and dig into what you said from a financial point of view.
Mhm,
The original light bulb, as far as I know, the original light bulb that Thomas Edison created is still going,
mhm,
right?
yeah,
It's this thing called planned obsolescence, because if you buy a light bulb and it never burns out, like, what are you gonna do as a manufacturer, right?
right,
So, a reasonable amount of time you wanna keep it, right? Maybe
mhm,
you're gonna redo your house anyway, so let's go ahead and plan it for that, right?
yeah,
But there's no difference than that with tires or any other consumable, and we all just agree that that's about okay, you got me. The car blew up 2 years, you know, after
yeah,
that. There's a couple of lemons, right? But for the most part, they last for a while, and
right,
you complain, and eventually you buy a new one, but you can take it.
right,
Those are those are elastic demands. Those are things that we
mhm,
don't necessarily need to survive, right?
mhm,
Healthcare is as inelastic as it gets if you wanna live, right?
yep,
So,
yeah,
forget about the accidents that happened before, things that you can't do, but, like, something that we have done to ourselves or something that, we find out, like, I wanna be cured. I don't want my symptoms to be, dulled or, additional life with additional issues. If you can find a way to fix my kidneys, I'd rather not go to dialysis ever again, right?
right,
Something like
right,
that. But that's not the way the healthcare system works, because once they have a client, they want to have that client for life. So,
yeah,
as you said, it is a sick care system right now. It's not a
yeah,
healthcare system. And
yeah,
insurance in its purest form, unless you're self-insured,
mhm,
or you're working with, your own captive, is not even insurance, it's managed care, and they're going to give you what they can give you at the very least to keep you
yeah,
spending money,
yeah,
right?
yeah, and it's so
And
it's
and you
so
have to use and so you have to use the tools that you have to
yeah,
avoid that situation, which is something like your solution, right? Try to
right,
make it as painless as possible, because you're gonna have to go through all the emotional
right,
problems with healthcare.
right,
You're gonna want someone like Kayla on your side to
yeah,
help me navigate the
yeah.
system when I'm sick, right?
Well, if you think about it, it is such interacting with the healthcare system is by far one of the most stressful things Americans go through because, like you said, it's that interaction between the emotional part of it, because right, you're sick or your loved one is sick. Like that, anyone who's been sick, especially like extremely, extremely ill, or hurt, your life is on the line. So you're not even thinking about finances. You're not even thinking about and you wanna go to the best place. You wanna go to go to the place that gives you the best probability that you're gonna come out
Right.
alive. But
Mhm.
the way that, it's been built now is that and a lot of people, they do this shortcut, right? Where they think, "Oh, if it's a higher price, then I'm getting the best
Mhm.
care. This is, Joe Schmo. I've got
Yeah.
the celebrity surgeon over here because they're charging the most or whatever. And there is no correlation between quality of care and price. That's been proven
Right.
over and over again. There's no correlation. And we see that every day. And so, but again, as a patient, especially when you're emotional, there are certain parts of your brain that's just trying to problem solve. It's just trying to figure it out so we can get out of this solution or get out of this issue. And so you're not even the, you it honestly preys on that part of your brain that is just wanting to get the best care because you automatically think it's got to be a high price. And
Uh-huh.
I mean, that's where a lot of people fall.
Yeah, to highlight that, if you go to, when you go on Amazon, you're looking for a toaster, you're going to look at all the details and all the things that are what volts does it draw. If you're living off grid or if you've got a boat, you're looking at the details, right? Um, and if it's got 2 stars and there's one that's cheaper that has 5 stars, you're gonna look
Right.
at least the 2 star and figure out whether it matters. Why wouldn't you do that for your own health? And here's the thing:
Mm.
even if you try, a lot of that data is not there yet, right?
Mhm.
It's hidden, and it's
Right.
hidden for a simple reason. Like,
Right.
they don't want that transparency. Now,
Yeah.
to be clear, to be honest, there are chief of hospitals that are surgeons that are amazing surgeons, or they wouldn't be chief, and their numbers are going to be lower than average because they're getting the hardest cases, like
Right.
the almost impossible cases. And if you want somebody on
Right.
the job that's going to do that, you've got that. But for the most part, if you're going
Yeah.
in for a routine procedure, wouldn't you
Right.
still want to have it done cheaper and with highest ratings?
Right. Well, so that's the thing and it gets so complicated for patients who are not informed because let's talk about like ratings and reviews, right? If you go on Google and find a hospital on Google and their reviews, 9 times out of 10, those reviews are not, a good way to like, say for sure, "Oh, I'm gonna give the best quality of care."
Mhm,
Because 1, a hospital, you get so many things done at a hospital. They have GI, they have cardio, they have ortho, they have so many different aspects. So, that's not specific to whatever your needs are. But, like, going back to the MIPS score, for those who don't know, a doctor's MIPS score is what CMS they grade doctors yearly on their clinical performance. So, how outcomes like, clinical outcomes from your past, either surgeries or how you've, like, dealt with patients. And so for, surgeons, like you said in your example, the surgeon who gets the hardest cases, it's best to also look at their MIPS score because you know, it's not just about, if the patient liked the procedure or whatever. It looks at everything. It looks at, for example, it looks at if you're the diversity of your patient. It's looking at if you are implementing value-based care in your part where you're not just, doing the fee for service model, but you're also doing quality care, like value-based care. And so it looks at a diverse number of things to grade you. So not just on your outcomes, but also just how you deal with patients as a whole. And
mhm,
so again, it's stuff like that where your reviews can't tell you that, but that's normally what all of us go on for everything else. And
mhm,
so that's it again, it's more complicated than it needs to be, but that's how it is. That is how it is built, and you have to be able to have at least someone in your corner to be able to tell you, you know, if it like, tell you these ins and outs, and unfortunately, a lot of people don't have that, which is why they go to our app because, who has a Kayla in their house? Only my mom.
yeah, and Kayla, honestly, like, if somebody was trying to build up a benefits department or even just add somebody to benefits or give someone the roles that you fulfill, what would they need, to do, or they could hire you, right? What are the
So,
benefits to the company, and how much more of a heavy lift is it to do that?
um, you would Jesus Christ. So you would need well, I say that because it's right, so it's it you know, I started this 2 years ago. There are so many, just to give people like an overview of everything that we do, just like really quickly, right? So we
Yes, please.
provide low cost labs, low cost medications. We help you manage your benefits with your out of pocket and max out of pocket. We negotiate your medical bills. We show you doctor information, like clinical performance, things like that. We have hospital prices and hospital quality. And I'm adding, oh, we have like a wellness addition as well for weight and things like that. So to be able to first, you'd have to take all of the national information on doctors, hospitals, ERs, um, um, their prices, their quality scores, their billing ethics. There's so much, and I'm leaving out a lot, but you'd have to acquire all of that data, which for a regular patient and just for like a benefits department,
Mhm.
that requires a huge server,
Yeah.
like, and multiple servers, which is what we have, but just the data alone is a lot. Then you have to comb through that data. I don't know if you've ever looked up a hospital price file before, but it's nearly impossible because you have to have, I think the max, storage that it requires is, I think, 120 megabytes
Mhm.
just for one hospital. And then I remember we were when we were doing this, because we do it every quarter. There are some hospitals that make it so difficult for once you even open that file, they will put in a bunch of mumbo jumbo for the first 20,000 cells or 20,000
Mhm.
rows, and then you actually find it at the 21st thousand row, right? And
Mhm.
so you would really have to be, it would be a lot. It would be a lot. I mean, it's possible, but if you don't have someone who's been in healthcare, specifically hospitals and insurance, because we are in that intersection between hospitals, insurance, pharmaceuticals, labs, imaging. So you'd have to have some like a huge team that is experienced in every last one of those. Plus, they have that digital expertise that we have. So nothing is impossible, but it's a huge lift that most companies aren't built for, and it would kind of be a waste of resources because there's such a huge learning curve.
Are you nationwide or are you local?
No, we're nationwide, so every part of the US we have data for, which is why I was talking when you said that, I like my eyes blew up because just getting the data alone, like now we have a system, but in the beginning, I remember the first year, it was like death on a stick
Yeah.
getting that data alone. Now we've been able to make a bunch of code, automate it, and be able to have our own proprietary um, tools to be able to get all that information quicker and easier, but again, we had to make all of those tools on
Right.
our own. So, yeah.
And do you work with like data warehouses or how does how does an employer work with you? Like what would they need access to? Obviously, they would need a friendly broker that would allow you to be part of the process, right?
Yeah.
And then how would that how does one engage with you, and how would one know that they would need to engage with you?
So I'll work backwards. For your second question, on how to know, you know by your healthcare costs. Are they, one, out of control where it is eating up your bottom line? Because that's really when unfortunately, a lot of employers that we've talked to, because this year, premiums went up sky high, healthcare costs went up, I think, by 7 or 8%
Mine
back.
went up 16.
Damn, is that really bad?
Yeah.
Yeah, so, and those were just, like, on average, so
This-
most people by now are looking for solutions because it's too much right now. It
Yeah.
is eating up people's bottom lines. Construction companies, manufacturers, companies like that, they're really hurting because they have the highest healthcare costs. So one, it's if your healthcare costs are extremely high and you need something to manage that risk and lower your claims and things like that.
Is there a
Um,
size? Is there a company size that is, that you'd wanna start at or size agnostic?
So we normally start at 50 employees. Believe it or
Mhm,
not, there's a lot of even small companies are really more than larger companies. They're really, really hurting.
mhm,
But large companies as well. But on average, who we have, like the ideal person that we have on average is anywhere from 1,000 plus
mhm,
because their healthcare costs are in the 7, 8, 9 million dollar range, right?
mhm, mhm,
And so they get a lot more benefit from us because you were able to reduce your claims up to 30%. And so that's one how you would know that is just by your healthcare costs rising too high every single year. Next, one we work with brokers. We love our brokers because they do so much. They really do a lot for their client. And
mhm,
what I've noticed is that the brokers that come to us wanting to add us as a solution in their tool belt, they're normally the ones that are either, um, top of their game because they know what it takes, right? You can't just be selling the same thing everyone else has sold since their grandma was born, right? You
yeah,
need to stay up to date, and these are things that, employers are looking for. They wanna make sure that their benefits consultant is, showing them everything that they need to see, is taking care of them, right? It's a
mhm,
trust thing, ultimately is what it is.
mhm,
And so we work with your broker to, one, provide the benefit in your employee benefits, and then if you have a TPA, if you're self-funded, we also work with them to make sure that everyone's on the same page. So we really just become part of your benefits team, and it's a pretty easy turnkey solution. We don't require much except, your employee information so that we can make their accounts. But like I said in the beginning of this call, our whole brand is easy. If my
mhm,
grandma cannot do it, then I'm not putting it out there because she uses it, right?
mhm,
And
mhm,
so same thing with employers. We make it extremely, extremely easy so that all you have to give us is your member detail plan
mhm.
and restart running with it. So again, that's how it normally goes with us.
So, you mentioned something earlier that I'm just curious about. So, if you're working with an employer and they reach out to you post fact, injury, post whatever, you help with like billing, but is there obviously maybe they should be calling you ahead of time, like right at the time that they needed service, I'm
So what
guessing,
do you
or are you proactive on when you see their medical claims file come through, you automatically, grab it and start working on it for the employer, or do you
Gotcha.
wait for the employee to make a request first?
So so it's an app, native app. So it's gonna be on every one of your employees' iPhones or Androids.
If
Um
they download it, right? Yeah.
Right, well, so it's that and their desktop. So what we normally do is we are proactive in reaching out to the employees first off,
Uh-huh.
and we make sure that we get everyone on. If you're not on, then our in-person navigator, so we have someone like a human person that is our in-person navigator that books meetings with the people in your company that haven't used the app or seldom use the app. And she
Mhm.
checks in with you and makes sure like, okay, how's everything going? I know you had a surgery last year. Are you feeling okay? Are you feeling any like do you think that you'll need another doctor or just trying to check in with them for their healthcare to make sure, okay, if you're planning on or need to interact with the healthcare system, how can the healthcare navigator make sure that we're, again, guiding you? So they will book appointments like one-on-one like this with your employees. So that's how we safeguard against employees not using it. Because I always say if they're not using it, that's really bad for us. So we make sure both from the app wise that we're making sure that people are interacting with our app constantly. Right now we have about a 73% engagement rate. So that means 73% of our users come back to our app every 1 to 3 weeks. And so we do that through intensive marketing, intensive just getting in your face constantly,
Mhm.
to make sure that people are, using it so that the employer gets the most out of it.
And that's kind of critical. The one thing that I noticed, and the one thing that I try to focus on when I'm advising people on some of these types of things is like, if you're not using that app, there is a cost involved, right? Not just fiscal, there's also like utilization. You're wasting
Right.
time for your employers, your employees, so they need to be using it in order to get the benefit. Otherwise, it's not moving the healthcare needle, even if it's a good idea. So,
Right.
you have to make sure that any solution that you put out there or that you're spending money on is
Yeah.
moving the needle, not just doing something for a check the box and pretending that I'm helping. Because healthcare
Right.
has plenty of fraud, waste, and abuse. They don't need any
Already.
additional.
Yeah.
Yeah.
Well, the good thing about our app is that one, it's primarily made for the person. Like I always say it was built for the patient. So yes, it helps the employer tremendously. And that's great. But our primary focus is that employee. They are ultimately our customer, even if they're getting it through their employer. Because if we make sure that the employee is okay, that we are at their beck and call and making sure that they're saving money, ultimately that goes on to the employer. So I always zoom in on the employee when it comes to whatever feature we make, whatever new module that we have in whatever update. I want to make sure that that employee loves it the most, because if your employees don't like it, they're not going to use it. So no matter how I remember when we were starting, there was one gentleman, bless his heart, who he was like, well, you guys need to add this and you guys need to add that, and it was a bunch of like technical stuff. He was very very he was into it, right? And so he was wanting us to add all of this technical aspect to it. And was like, respectfully, we can do, because we can customize the app for your business. But I said, respectfully, if we do that, no one is going to use the app
Mhm,
because it's
mhm,
going to be too complicated. They're not going to know what any of that means. And people just want to get in and out. No one really wants to deal with healthcare. So when they're forced to, they want to get in and out and know that they're being taken care of. And so I had to, once I kinda explained it to him, he understood, but I was like, we make this for your employees. Happy that we're helping you, but your employees are our number one focus, and that's the driver, and that's how we help save you money. And so that's what you have to kinda remind the employers sometimes, and that's why we're able to save them so much money, right? Is because 'cause we're focusing on the employee the most.
yeah, because I mean, it's like, the if you're keeping the employees healthy, they're productive, and if they're productive, they can earn enough money to retire, and if they earn enough money to retire, you can hire new staff that
Yep.
continues the succession plan of a successful company. But if you get stuck, this is one of the things that I started with 100 years ago working with retirement plans. It's like, you want to have a retirement plan as early as you possibly can for your company if you know it's gonna be a successful company, because you want those employees to save it up enough money to not be elderly when they're working for you, because then what does
Right.
go up? Your healthcare costs, right? Your
Exactly.
healthcare costs, all of your benefit costs go up. So you wanna keep employees fresh, and what's the humane way of doing that is paying them enough to be able to retire, right? And giving them the right support
Right.
along the way so that when they are retired, they can, you know, go enjoy
Yeah.
themselves for a while.
Well, it's also about, I would add that it's also about productivity, right?
Sure. Yeah.
I mean, and everyone's been here, right? If your child is sick, if grandpa just fell down the stairs and got a fracture, you're
Mhm.
thinking about them the whole day, right? And that's as it should be. And so you're thinking about them. You're not thinking about work. When you're in that meeting, you're thinking about what hospital, what medical bill, what this, and that, pharmaceutical. You're thinking about them. And so
Mhm.
that hurts your productivity because
Mhm.
your mind's not on, your work. And so I would even add that, in making sure that your employees are not bogged down by the stress of healthcare helps with your productivity. And so that's really what we've done, is taken it and made it a stress-free experience where, instead of just making a decision blindly and interacting with healthcare blindly, now your employees go to us first before they make any decision. And that's that was the vision in mind, and that's what it is doing now, is where they come to us first to make an informed decision so that they don't have to come back to us later and be like, "Ah, I need help. Can you please help me?" Like, we're happy to do that, but we wanna be proactive in that, and so that's what it's, built for.
Great. Well, one part of the show that I really love is asking people how they got here. How did you become an entrepreneur? How did you make this journey? What prompted you?
Yeah. Well, so I think I already said in the beginning of this podcast, but I previously worked for a hospital association. Well, I first started the really, really beginning of my healthcare journey started in hospice, which everyone, whenever I told them, they're like, "Oh my God." But it's true. First interaction was hospice, and that really gave me, I mean, when you see people literally on their deathbed,
Mhm.
right, to be quite frank, on your deathbed, it gives you a way different outlook on life in general, but also healthcare. And it really puts, it's hard to explain, but something changes in you and you don't come out the same way you came in. You don't.
Can I never worked in hospice, but I have a good friend who, um, had a relationship with a hospice nurse for an extended period of time, and his life changed just by, her experience, and the easiest way
It
to say it is that, like, no one ever on their in hospice said, "I wish I would've worked more," right?
Yes, on their deathbed. Yep, 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 yep.
And we're
Um,
all gonna get there, so don't you want a better way to get there, right? So
yeah. Yeah, well, it's, um it's interesting, the real you does come out when you're on your deathbed, and, um, you know I've seen it where people, they're just full of regret because they either treated people in their lives really badly, and now no one wants to come see them on their deathbed. I've seen it where, you know, they've lived a great life and they were lovely to the people around them and their families, so they have so much support. I've seen it where, like dementia patients, unfortunately, they start losing so much of themselves as they're dying, and, you could tell that they are scared. And
Mhm.
so what it does to you when you do work in that environment is that it helps you see people as people, right? And it helps you see them not just as an adult, but also as a kid.
Mhm.
As, like, you can visualize, see them, because when it's very hard to explain, but
Yeah.
you see that inner part of them. And so going from hospice to corporate healthcare was definitely a weird, weird transition for me. But I loved being in the hospital because that's where the action was. People like to call me an adrenaline junkie because I do love that adrenaline. I love the rush of, I love the rush of, quote unquote, saving the day, right?
Mhm.
And so I could do that through leadership. And so being in that world, though, was way different, and unfortunately, even though I was great at my job, I started seeing patients as numbers, not as people. And as one does when you work in the corporate world, you drink the Kool-Aid and you that's just how it works. That's how it starts. But it wasn't until my grandma, she started having lots of issues and was going back and forth between the hospital and between her doctor, and it wasn't until that happened where I realized, okay, so the strategies that I was implementing, now she's being affected by. The strategies that I was implementing to increase shareholder value, maximize revenue, put in your favorite corporate word here, those I saw what the end result is for the patient.
Uh-huh.
And that made me honestly disgusted with
Mhm.
myself. I felt like there was nothing I could do. I was familiar with this tactic. I was familiar with, what was happening to her, and I was a part of that planning process. And so I really just couldn't I could not reconcile with that and just like stay there. And so I wanted to create something where I could 'cause I couldn't be in 2 places at once with her, so I was like,
Mhm.
"It would be great if there was an app where I could just, be in the app telling her, like, all the ins and outs to help her navigate it," and so that's really how it happened, but it was
Mhm.
just getting sick and tired of, it was getting sick and tired of seeing people being taken advantage of when they were at their most vulnerable and most weakest,
Yeah.
and that is the part that I could not deal with once it happened to her, and so, take that as you will, but it's the ugly truth.
Yeah, and really it's this is not uncommon. Most of the people that I talk to in healthcare that have changed, you talk to almost anybody in the health Rosetta community. There's the but and until. I was working
Yes.
for name large healthcare company, and now they're on the other side of the equation because of the but and
Yes.
because, right? It's like I
Yes.
did this and I had a great life, but something
Yes.
happened to name family member and
Mm.
I saw what I did. And I heard this yesterday on Bloomberg. I wish I took note of who said it, but it was there is nothing harder to change than a business model that's working, right?
Right.
And unfortunately, we have 20% of gross domestic product now is healthcare related, and it is getting bigger, right? It's up from
Yeah.
like 6% not too terribly long ago.
Yeah.
Obviously, they have found a way to grow market share of
Yeah.
GDP, and not in a good way. That's why what you said earlier about the law that like or the executive order, I believe, like tell us what happened yesterday.
Yeah, so, big win for all of our advocates and patients everywhere. So the bill was passed for this is for American government, where now instead of your medical bill debt influencing your credit score, it's been wiped out. Like it's not even supposed to be, will not even be on your credit report anymore, and it won't affect your score. And so, that is a huge win for patients everywhere because most Americans have medical bill debt. It's a very, very common thing, and it's not like a cute $2,000, $3,000. We're talking tens of thousands of dollars.
Mhm.
I actually, because again, we're in the middle of reading through all of our user testimonials from 2024, and one, bless her heart, had a $40,000 bill from the ER, and, it made us all tear up when we were reading it. Obviously, she was able to, negotiate it down with our care genius because she found errors, but it was still high after that. I think we only were able to drop it down by 10,000, which, yeah, it's a lot, but still, that's $30,000,
Mhm.
and that's a lot of money, especially for her age. She's 27,
Oh,
so she's just starting out in her career, especially, like, where she is at financially. And so people everywhere are affected by
and
medical
it's
bill.
it and it's always done by like a simple signature somewhere or something that you didn't know. Like you're pushed into it, as you said. So
Yeah,
it's tough, and I'm just super happy that there are companies and solutions out there like yours.
yeah,
How would people find out more about the Healthcare Navigator? And it's the beginning of the year. This is a great opportunity for people to start paying attention because obviously there's a lot of
yeah.
legislation out there. How can people find out more about you?
Yeah, so you can go to our website, www.thehealthcarenav, so nav.com, and on average, we're able to save patients about $4,600, annually, so multiply that by the number of employees you have, and that kinda gives you a range of how much we're able to save them, but, you can go to our website for that, and then you can also go to our LinkedIn, and it's just at the Healthcare Navigator. That's, again, very, very simple, but you can go on there to either get a demo, and we can also give you a savings analysis to kind of show you exactly where we can help save you money and things like that to get you, on the right track.
That's great. Well, thanks, Kayla. I appreciate you joining us for another episode of Money in the Bank with Frank.
Thank you so much. This was
I
so
look
much fun.
Yeah, and I look forward to talking to you a little further whenever I find some other topic that I'm like, "I know who knows."
Yeah. Yeah, yeah, I'm excited.